Hello, I'm Dr. Holds and welcome to our practice. Some of the most common problems I treat are malpositions of the eyelid, sagging, in-turning, or out-turning eyelids. The problem I want to specifically discuss in this clip is an in-turning or out-turning eyelid. An in-turning eyelid is an entropion. An out-turning eyelid is an ectropion. And I see many patients who have one problem or the other. In most cases, these are lower eyelid malpositions that we need to treat. An ectropion or out-turning eyelid can be a result of age and laxity associated with age. It can occur after a facial paralysis type condition where the muscles weaken, allowing the eyelid to sag and turn outward. Or it can occur due to scar tissue formation, loss of skin, such as an injury, or sometimes simply with age and sun exposure. Also, occasionally, a mass, just a mechanical problem, can rotate the eyelid outward. When an upper lid turns outward, it's usually a little bit different situation, and some of these are a little bit more challenging to treat. An out-turning eyelid often will have symptoms associated with tearing, irritation of the eye from even drying, exposure problems, or the outturned tissue can dry and become irritated, develop what would be called a conjunctivitis from the inner layer of the eyelid turning outward and becoming exposed. And these can all be indications for repair of this kind of eyelid malposition. The repair of an out-turning eyelid sometimes involves simply a tightening type operation, usually done under a local anesthetic, in which we make an incision in the eyelid, either in the inner corner or outer corner, typically, of the eyelid. Sometimes an internal incision to put in rotational sutures and aid in rotating and stabilizing the eyelid, and then tighten the eyelid. In some cases, it's necessary to additionally actually graft or add skin to the lower eyelid as a lengthening to the anterior portion to allow enough vertical length to allow the eyelid to rotate inward. And in most cases, we can correct an out-turning eyelid in this fashion and resolve the problem. A separate problem is an in-turning eyelid. With an in-turning eyelid, the lid margin is rotated inward. Often eyelashes abrade the cornea, the front surface of the eye, can cause tremendous irritation, and sometimes be truly threatening to the health or survival even of the eye. An in-turning eyelid can be caused, again, on a basis related simply to aging. This may be an age-related change which destabilizes the eyelid and allows it to rotate inward. Scar tissue formation, for a variety of reasons, can cause an in-turning eyelid. Also, you can have in-turning on a mechanical basis. An in-turning eyelid, the more common sort, can be repaired with probably a 95 to 98% success rate using a fairly straightforward technique under a local or sedated local sort of anesthetic. An in-turning eyelid, in some circumstances, will require grafting of tissue, such as mucosa from the mouth, nose, or opposite eye, to lengthen the inside of the eye and eyelid and allow the eyelid to be rotated back into appropriate position. Upper lids that rotate inward can also be repaired. These are sometimes more troublesome and more challenging than an inward rotating lower eyelid. As mentioned, most repairs of an in-turning or out-turning eyelid can be performed under a local or a sedated local anesthetic on an outpatient basis. The most common difficulties or problems, any operation, there's a certain failure rate, and depending on the problem, this varies from a few percent to maybe 10 to 20%, depending on the underlying problem. But most in-turning and out-turning eyelids, the success rate for repair is going to be very high. The other surgical complications that one would have to consider are just some general surgical complications, bleeding, infection and so forth, which again would rarely be of a serious nature. And then the risk to the eye is usually very small. And in fact, in most cases, we're performing this sort of surgery actually to protect and preserve the eye. So on average, the eye is going to be better served by proceeding with surgery than by not. And depending on your condition, I'll discuss with you what other specific concerns we might have. So I hope that this video gives you some perspective on these sort of problems, and we'd look forward to examining you and discussing the treatment of your eyelid malposition with you. Thank you.